Role of yoga in substance use disorders. So far in this area, 17 randomized controlled trials have been completed, and 3 randomized controlled trials out of that is in severe uh, uh, substance use. All are severe, but opioid use disorder, the heroin addiction, leads to very severe withdrawal symptom. There are 3 randomized controlled trials in that area. If you look at these RCTs, the most commonly studied outcome variables are quality of life, mood, stress, and anxiety. Whereas the core addiction outcomes have not been studied, whether it is abstinence, craving, pain. Similarly, the mechanism of action has not been explored much. There is only one study that has shown that in people with alcohol use disorder, yoga practice of 12 weeks can bring down cortisol levels. So the neuroimaging studies are lacking in this area. Similarly, the biomarkers other than cortisol have not been explored. This, you would have seen this figure in the chapter also. How does yoga work? Primary mode of action is bringing an activation of prefrontal cortices. Specific yoga interventions, specifically fast yogic breathing techniques such as Kapalabhati Bhastrika, they have been demonstrated to bring PFC activation, and chantings, specifically Om chanting or humming through the auricular branch of the vagus nerve has been shown to bring limbic deactivation. So activation of PFC and deactivation of the limbic cortex. This is the mode of mechanisms of yoga, how it can help in substance use disorders. This is the paper I was talking about. This was my MD thesis. We were able to demonstrate that immediately during a fast yogic breath, that is Kapalabhati pranayama, there was increase in the oxyhemoglobin in the bilateral prefrontal cortices. This idea came to our mind because of the very nomenclature of the technique. Kapala Bhati. Kapala means forehead and Bhati means shining. So a technique that involves flapping of the abdomen, why did sages name it as forehead shining breath? So one is probably increase in the circulation in the face and glow on the face. But when we look deeper, we actually observe that this technique is able to bring bilateral prefrontal oxygenation, increased microcirculation in the bilateral PFCs, and probably that is more scientific interpretation of the name Kapala Bhati, forehead shining breath. Similarly, Om chanting, replicated studies. This was first study done in 2011 by Kalyani et al., who is Dr. B.N. Gangadhar sir's daughter. Then this study was replicated by Naren Rao et al. In 2018. And both the studies demonstrated the same thing, that when you chant Om, the limbic area gets deactivated. And study was also able to show that the effect is mainly due to the Ma component of the Om. Even if people do simple humming, similar kind of effects are observed. So deactivating the area related to craving, related to emotional sensitivity, reactivity, and activating the area related to impulse control, that is PFC, is the bimodal approach through which these techniques can help substance use. So two most important evidence-based techniques for substance use are Bhastrika or Kapalabhati, followed by chanting Om or Brahmari. So it has this mechanism that these kind of techniques can immediately bring calm and reduce craving and give better control on oneself. This is what Patanjali says in his sutras. If the awareness is turned inwards, then the obstacles are overcome. This turning inward happens by tad japas tadartha bhavanam. Doing that Om japa with the bhavana that I am withdrawing and going towards the very source of creation within the bottom of my heart, within the depth of my heart. So this withdrawal of the senses, the consciousness that always moves outward inside, is the mechanism through which avirati, the craving, is overcome. Then the parable of the chariot is another beautiful example that comes from Katha Upanishad. The five powerful horses are the five sense organs which are driving the consciousness out, and the intellect is the prefrontal cortex. It is the fellow which is trying to control the amygdala, the limbic area, and the horses are being drawn by the lower brain areas, the amygdala, the limbic area. So PFC is the charioteer, and the limbic area is the five horses. That regulation is very important, especially in younger age groups, in adolescents. The limbic area matures much faster than the prefrontal cortex area. This leads to a neurodevelopmental window, specifically from the age of 13 to 24. The prefrontal cortex is still maturing. Amygdala limbic area has already matured. So the individual, due to that age itself, becomes more impulsive, more risk taking, more emotionally reactive and sensitive, and his ability to control his impulses and decision making lags behind. During this time only, individuals become very, very vulnerable in to get into substance use. In substance use also, the earlier you get into a substance, the more it gets wired into your brain, and it is more difficult for such persons to come out of the substances. Specifically, if the first exposure to the substance has been in early teens, that is before 20 year of age, as compared to after 22 year of age, then people who are addicted before 20 find it much more difficult to come out of it. If a person gets into addiction after 24, when PFC has fully matured, then it is easier for such a person to come out of addiction. Now, here, the cognitive behavioral therapy and Western approaches of psychotherapy focus on strengthening this intellect by bringing a change at the level of thinking, changing the schema, changing the self esteem domains. Whereas the Eastern psychotherapeutic approach focuses on this fellow sitting behind with folded hands, the Atman, the consciousness. The whole philosophy is that if this intellect is able to draw strength from the consciousness, intellect will become more skilled to manage the senses. How do you do that systematically? So, yoga uses this five layered existence model, Panchakosha model. Annamaya, Pranamaya, Manomaya, Vijnanamaya, and Anandamaya are the five koshas. Very important thing that this model teaches us is that my happiness for which I am getting into substance. If you ask people, especially those who get into the substance earlier in the age, why do they do that? They do it for seeking pleasure. Those who are already into substances, those who take heroin, those who take alcohol, cannabis, they say, when I take substance, I feel calm and relaxed, my mind relaxes. So ultimately, what is the individual seeking? He is seeking Anandamaya Kosha. But what is the approach that the individual uses? He uses certain kind of substances which belong to Annamaya Kosha. So Annamaya Kosha, some substances are taken and they open a window towards the Anandamaya Kosha. So the question that I would like to ask people here who are there in the meeting, what is the difference between the Ananda that comes to a person through use of substance versus the Ananda that a meditator or a yogi gets by meditating? What do you think is the difference between the two Anandas? Anybody would like to share their views?
Is it a short term when with the substance abuse? The Ananda is short term. When the effect goes, the ananda goes. That's what I feel.
Aparna says two differences. She says that the effect is short term. Once the effect of the substance goes down, the ananda also goes. In fact, it leads to hangover and rebound irritability and sadness. Whereas the ananda that comes through yoga and meditation, that is more sustained. Rakshit?
Sir, I feel with a substance use, there is no conscious but ananda. But in meditation, there is a conscious and ananda.
So conscious ananda and unconscious ananda. That is the difference that Rakshit says. What does Anu say? Anu, please unmute.
Sir, in the substance abuse, we are getting due to the consciousness, that is ananda, due to the effect of the drug. But in the meditation, we are getting all layers in the proper way, from the pranamaya kosha, then all from the annamaya kosha, pranamaya kosha, everything will be in the normal state. But in the substance abuse case, only we are getting a sort of anandamaya kosha, kind of ecstasy. It's not like the consciousness we are getting proper with the meditation.
Okay, so Anu brings in a very interesting point. She says that the ananda that comes by doing yoga and meditation is it brings harmony in all the layers, and that is the real ananda. Whereas the ananda that comes out of substance use is a sort, it appears to be ananda, but it is not ananda. Yes, we will discuss more about it. Madhavi and then Vishwesh.
Sir, in substance abuse, temporarily he'll be touching the Anandamaya kosha with the use of external agent. But in meditation, we are not using any external agent to touch that Ananda layer, sir.
So Madhavi, you feel that both the ananda
without any effort.
So you feel both the kind of ananda come from Anandamaya kosha only. Madhavi?
Yes, sir. Yes, sir. But
Oh.
it is for short period, and then through external agent only you're getting to that state, sir.
Okay. Okay, Madhavi. Vishwesh?
Hello.
Yes, Vishwesh.
Sir, in the substance use, there is samskara created for getting the ananda, while in the yogic practices, this is not the case.
Beautiful. So Vishwesh says that the joy or the ananda that comes from the substance use is because of the habit of repeated use, that samskara gives them a joy. So I would like to ask this question to all of you. How many of you agree that the ananda that comes from taking a substance and the ananda that comes by yoga and meditation both come from the Anandamaya kosha layer? Those who agree, please raise your hand. Both come from the same layer. If you agree, you raise your hand. If you disagree, you do not raise your hand. At least Madhavi should raise, yeah. Yeah. Bhavana. Two people out of 118. So I would now like to ask question to other 116 people. Okay, I am also there. So 115 people. Where is that Ananda coming from? You take substance. Okay, if substance is difficult to understand, you indulge in sex. Sense organ are touching the object. There is Ananda. You cannot deny that there is no Ananda, no pleasure, no bliss. If not from Anandamaya Kosha, where does that come from? Anyone from 115 who did not agree can share their views. Vishayananda and Yogananda. Two Anandas we are discussing. Yogananda comes from Anandamaya Kosh. You say that the Vishayananda, Ananda of the sense pleasure, sense and object contact. There is Vishayananda. Everybody agrees there is Vishayananda. Where does that Ananda come from? Which layer? I have to put my chart.
The outermost layer,
Which layer, madam? Annamaya?
Annamaya Kosha.
Okay. Annamaya Kosha is what Usha says. Can Annamaya Kosha lead to Ananda? Mhm. Is Ananda a property of Annamaya Kosha? Annamaya Kosha is matter. जो शराबी मूवी आपने देखा है उसमें अमिताभ बच्चन ने एक गाना गाते हैं, नशा शराब में होता तो नाचती बोतल. Does the Annamaya Kosha have that Ananda? Is the Ananda there in the matter? Madhavi?
Sir, mental modifications are suspended, and then if he takes the food he likes, he temporarily touches Anandamaya Kosha, sir.
Madhavi says that no, both Ananda are from Anandamaya Kosha only. Srishti, yes, please.
Sir, I feel the lower three koshas are related with the
Vishay.
happiness. Yeah, Vishayananda. So there are various forms of happiness. Like if we eat the food we like, we'll become happy. If we see a person we like, we'll become happy. Or when we are in an environment or a place which makes us happy. All these are temporary and each affects a certain layer. But the Yogananda, the eternal bliss, where in the presence of the stimulus or any object, it doesn't matter, it doesn't get affected, the person will be happy in that situation.
Okay, okay.
So I feel all three layers are with the object or the first three layers.
So you require another, but the Annamaya Kosha is that you are within yourself. That is what you mean to say, I think.
Yes. Um,
So Srishti
yeah.
says that the first three layers require contact with the object, and the Ananda comes from that. That is Vishayananda. But the Yogananda is when you do not require any other external agency, and Ananda comes as your own nature. That is Yogananda. The point that I wish to say is that Ananda in its substance, is it really there in the Annamaya Kosha? Is it really there in the Pranamaya and Manomaya Kosha? Do they have their own Ananda there?
No.
Usha says no. Ramani?
Sir, I think Vishayananda comes from Manomaya Kosha, as whatever we experience during Vishayananda is temporary. And as I've studied in the matter you have shared, Manomaya Kosha consists of, I mean, it is a layer of emotions and is related to amygdala and limbic system. So all this, according to me, Vishayananda
Comes from Manomaya.
yes.
So
Because
dear friends,
limbic system and amygdala is related to our Manomaya Kosha. And all what we experience as the symptoms of substance use disorder are reflections of limbic system and amygdala.
So here Ramani brings the neurobiology that if there is release of dopamine in the reward circuit, with that release of dopamine, there is a feeling of pleasure. So she says that it is happening in the brain, so it is connected to the Manomaya Kosha. This is the argument, interesting argument. Okay, so let us try to understand this phenomena from the traditional yoga viewpoint. In Taittiriya Upanishad itself, there is another chapter known as Ananda Mimamsa, the analysis of the happiness. Okay, so this particular technique or the Ananda Mimamsa has been used to develop different kind of meditations. One of the meditation that we used to practice in Swami Vivekananda Yoga University is chocolate meditation. This, children used to come with personality development camps, summer camps. There we would keep their favorite chocolate in front of them and then ask the children to sit still and not to eat it, just watch it. Looking at the chocolate, you salivate, you see the changes that are happening in the body, and then you see what is happening in the mind. The mind starts generating a thought. Let me have it, let me have it. Tongue is eager to have it. Mind is with the tongue to have it. Tongue is salivating to have it. Then the chocolate is slowly opened. It is touched. As you touch, you see the speed increasing. I want it, I want it, I want it. As you bring it closer and closer to the mouth, as you smell it, intense salivation, and the mind becomes completely focused on the chocolate and completely focused onto the tongue, which is waiting for the chocolate to touch. Mind becomes very calm, still. It doesn't want to move. Then you don't eat it, you keep it back. Again, the thinking starts. I want it, I want it, I want it, I want it. As the chocolate comes closer, mind becomes slow. As it is about to touch, mind stops. As it goes away, mind again starts thinking fast. Then, after one or two rounds like this, children are made to realize that eating chocolate is giving them happiness, but there is something that is happening in their mind with it. Then they take the chocolate, put it onto the tongue, take a very small bite and feel it. They see what is happening in the mind in the background. Mind has become completely silent, completely calm. And then in that moment, they are able to feel a sense of relaxation and inner bliss. But that doesn't last long. Then there is a desire to have the next bite. If left without meditation, they want to finish it very fast, but they are deliberately taught to do it slowly. At the end of the meditation, the conclusion is that I don't crave for chocolate. I crave for the silent, still, expanded state of my mind. Because in that state of my mind, my Anandamaya Kosha is reflected on my Manomaya Kosha. So the text says that all kinds of Anandas, whether it is drinking a simple coffee in the morning to the intense Ananda of Samadhi, they come from Anandamaya Kosha only. The Anandamaya Kosha can reflect itself onto the Manomaya Kosha when there is Chitta Vritti Nirodha, the fluctuation in the Manomaya Kosha stop. That stoppage happens when the sense organs meet the object. In sex at its peak, or with different kind of substances, or engaging oneself in art, singing, dancing, music. Wherever that peak experience comes, mind reaches a state of stillness and you experience Ananda, the bliss. All Ananda whether they come for a short duration or they come in ever increasing lasting pattern, come from Anandamaya Kosha only, because all other layers do not have Ananda in them. Ananda is a substance that you feel. Then the question comes, oh, if both Ananda are coming from the same layer, then what is the problem? I can approach it through sex, I can approach it through alcohol, through cigarette, and then the yogi is using nama japa or meditation or pranayama to reach the same. I am using another technique to reach the same. So both of us are reaching the same place. It means both of us are similar. So why then it is much easier. Now there are psychedelic gums are also there. So magic mushroom is there. So I would take that path. Then why should I toil for years together? Yama, niyama, asana, pranayama, dharana, dhyana. Why all that? If 60 ml of alcohol, if little bit of cannabis can give me that access to my Anandamaya Kosha, why should I take a long route? What do people think about this? What is the problem? If both can give the access to the same Anandamaya Kosha. Anybody? Yes, Madhavi?
Sir, it is eternal, it is steady, and you can maintain that without any until mental modifications are there, you'll be disturbed. Otherwise, you'll be staying in that state
In
forever.
Yogananda. In Yogananda. So what is
Yes.
the problem with
But
Vishayananda? If even for a short duration I am experiencing, I can keep doing that repeatedly, and that Ananda that I am experiencing is also from my Anandamaya Kosha only. So what is the problem in getting into Vishayananda again and again?
You cannot do that, sir, because subject through subject or through object you are touching temporarily. And for example, would like to give an example, sir. If you like a laddu, you can have one laddu, two laddu, three laddu, maximum 10. More than that, you cannot have, and then you will feel disgusted, and then you will be feel nauseated, and you cannot touch you cannot touch the Ananda layer with 11th laddu. So the person should realize that through laddu he is touching the Ananda layer, not laddu is not giving Ananda.
Beautiful, Madhavi. I want everybody to clap for Madhavi. Very well answered. Very well answered. So this is known as that happiness, and the amount of happiness that comes with each laddu doesn't keep increasing with number of laddus. It starts reducing. The happiness that the first laddu gives you, second laddu doesn't give you the same level of happiness. Third even less, fourth even less. So the exposure should give greater and greater access to Anandamaya Kosha. That doesn't happen. That is one problem. This in the neurobiology of substance use is called as tolerance. To achieve the same level of satisfaction after a year, you require double the dose or higher the dose of the same substance. So initially, one beer was sufficient. Now I require four beer to sleep or to get that calmness. This in Vishayananda requires higher and higher dose to reach the same effect, and it doesn't exponentially increase with that. Whereas in Yogananda, it is called as reverse tolerance. Initially, to reach that level of bliss and ananda, I had to do 1 hour of sadhana. After a year of 1 hour of sadhana, within 15 minutes of pranayama or chanting or nama japa, I am able to reach the same level of steadiness, calmness, and expansion that I was reaching in 1 hour 1 year ago. So, with yoga and meditation, the dose to reach the same effect reduces with continuous exposure. Whereas when it comes from external, the dose increases. This is problem number one. tolerance here, reverse tolerance here. Fine. This is a problem. Any other problem? Any other problem? Sushmita ji?
Namaste, sir.
Yes.
For this, in case of anything that goes through the Vishayananda, there is also some amount of disturbance in the initial layers of the koshas, the Annamaya kosha, or the physiological state of the body, or the mental disturbance that is that comes, like for example, with any behavioral or substance addiction in the Manomaya kosha, like that. And there is some amount of kleshas that increases, or because of the klesha that habit is forming. So the way that habit is formed is also because of this disturbance. So it cannot be long lasting. And there are many other adverse effects also.
Beautiful, beautiful. Sushmita brings in another very important point. Temporarily, you may feel calm and relaxed, exposing yourself to the substances or any sense pleasure, indulging yourself excessively. After that, what happens? After that, you end up becoming more agitated. You remain restless throughout the day. You see people who are into substance use, they can't sit still. They are so restless, always shaking their legs, can't fix their gaze at one point, always looking here and there. Any sense organ you get in excessively, you will see that your chitta remains in a vikshipta sthiti. You always remain agitated. So it is not only that during that phase that you experience momentary bliss, that is correct, but after that you become more self-centered, you become less sensitive towards others pain or happiness. You become more and more, this is called as salience. Your only focus remains on how will I get my pleasure. The more one get addicted to anything, the only thing one wants is I should get my dose. That is how people into substance use, into brown sugar and heroin, they kill others just for little amount of brown sugar. They commit any crime for little amount of money so that they can get it. So they start compromising their duties, they start compromising and cheating, they start cheating other, they start taking money, they start stealing money. So they become more and more insensitive about others feelings and become more and more restless within themselves. This is not only with substance use. Any excessive indulgence in any sense organ makes you little more insensitive towards others and more self-centric. So it should be regulated. I am not saying that it should be completely stopped, but it should be regulated. So the understanding is that thickening of the third layer hampers access to deeper layers. When an individual, as madam was saying here, that raga dvesha, when in the manomaya kosha, the likes and dislikes, abhinivesha, fear, and all those kleshas are thick. Lot of kleshas are there. In your scores, klesha score, if the percentage of raga, dvesha, abhinivesha, rajas, tamas, if it is going up, it means manomaya kosha has become very thick. Now imagine that Anandamaya kosha is like sunlight, and the Manomaya kosha is with lot of kleshas is like a thick black cloud. Now this thick black cloud will not allow the sunlight to reach the earth, which is your Annamaya kosha, the body. So then what does the person do? He doesn't feel happy or joyful in anything. He gets into substance. With substance, what happens? By force, temporarily, these kleshas are dampened, and by force, a space is created where some glimpse of his Anandamaya kosha is reflected onto his brain in terms of release of dopamine and chemical, and he feels his Anandamaya kosha temporarily. He felt that after the effect of that drug is over, or that act is over, the thick clouds which were separated by force by the drug, join back much more intensely as a rebound phenomena. You can see that through the black arrows where I am saying that it may separate it for that moment because you have taken a very intense dose of dampening your kleshas. But then as soon as the effect goes away, there is a rebound, even tighter closure of the Manomaya Kosha. Thickness of the Manomaya Kosha becomes even more, and then the person feels even more miserable next day morning. People who drink excessively, next day morning, they feel so miserable when they get up, when they have that hangover. They say, in life, I will not drink. But again, in 2 days, once again, their craving for their Anandamaya Kosha increases and they don't find any other way of joy that can give them that glimpse. They go with even higher dosage of binge drinking. Whereas what happens with a yogi? What does he do? He systematically uses the limbs of yama, niyama, asana, pranayama and starts thinning out this layer of manomaya kosha. He has very less ragas, very less dveshas, very less abhinivesha. From tamas to rajas, rajas to sattva, sattva to gunatita, the guna profile becomes very clean and chitta is in a very subtle state of balance and transparency, chitta vritti nirodha. So his Anandamaya Kosha starts experiencing or reflecting itself on the Manomaya and the Anandamaya Kosha effortlessly. For him, just sitting, doing nothing, closing the eyes, slow exhalation, observing the breath, and starting the japa of the Ishta Devata, he starts getting the glimpses of inner Ananda. So the yogi's layer is something like this. Anandamaya kosha becomes denser and the Manomaya kosha becomes thinner and it starts touching his body and he starts manifesting that ever increasing joy of his own Swarupa, that is the Sat, Chit and Ananda, that is the very core of one's existence. That starts manifesting at all the times. This is a yogi who is in a state of Nirvikalpa Samadhi. Whatever activities he is doing, he is feeling that inner bliss because his Manomaya Kosha is very thin, free from ragas and dveshas. And he has been able to achieve this by leading a life of following the yamas and niyamas for years together and then performing the systematic sadhana of nama japa, pranayama, dharana, pratyahara, dharana, dhyana. So till you withdraw and go inwards, the antar chetana, no, the real ever increasing bliss never comes. And the more we search this outside, the more agitated we become. So these are the tapaha, swadhyaya, and Ishwar pranidhana are the ways through which Patanjali tells us to channelize our energy and cleanse our manomaya kosha. So these are, we have already discussed this, that you can reach tapa, bhakti, jnana, different kind of approaches or selfless help to others to cleanse your manomaya kosha so that your ananda reflects more. This is how long-term rehabilitation in substance use is done. And whatever I have explained to you, from where does the ananda come, and whether the ananda comes from substance or from yoga and meditation, the source is the same. This kind of psychotherapy can also be given to the patient, and it actually removes the guilt from the heart of the patient. The guilt comes out because he says that, okay, in a way, I got addicted to this substance, but in a way, I am also a spiritual person because ultimately, what I am seeking is the peace of mind. Only error I did was that I searched that peace in the wrong direction. I searched it outside. I was supposed to search it inside. So this kind of approach towards substance use removes the stigma, removes the guilt, and the person becomes motivated to go in the right direction. So we actually developed a program known as Brief Yoga Philosophy based module for substance use. And there we searched these literatures, Bhagavad Gita, Yoga Sutra, Taittiriya Upanishad, Katha Upanishad, Uddhav Gita, Ashtavakra Gita, and came up with these concepts. One was Ananda Mimamsa from Taittiriya Upanishad. Second was inquiry into the self. No? The parable of the chariot, where we asked Who has the control over your life? The horses or the Atman, the consciousness? Several other concepts like Pratipaksha Bhavana and all came up in the developmental phase. Concept of Yama Niyama, non-doership. Finally, the validated module had two psychotherapy based concepts. One was Ananda Mimamsa and second was self-enquiry. So how does the psychotherapy begin? Can you describe the state of mind you seek when you use substance? We have done it practically with our patients. So what state do you describe? So he says that state is very calm, relaxed mind, all tension, worries wither away, you feel really relaxed, light-headedness. Then the concept also compares happiness derived from meditation with that from substance. Then you ask the person, show him Panchakosha model and ask him, this happiness of your substance and the happiness that a meditator gets in meditation, what do you think, where does it come from? People who meditate also seek a similar state of mind, calm, relaxed, no tension. What do you think may be the difference between the two, your happiness and their happiness? Then, additionally, it explores the true source of happiness. Is it the substance you crave, or is it the state of mind that the substance brings that you crave for? What do you crave for, the substance or the state of mind that the substance brings? Do you think it is possible to reach the same state of mind without any external substance? So this is the way that person is channelized towards yoga. The second part of this is the relaxation and peace of mind you experience while using substance. Which layer of existence do you think it comes from? And when using substances, do you think your intellect is under the control of your higher self or the horses? Who is the rider of the chariot in that moment of substance use? So, a inner reflection and also the reflection on what it will subsequently lead to. Anant Ajnana Dukkha Phala. So, it will just start a cycle of more suffering, more frustration, more ignorance, and it has no end. That kind of awareness is brought to the person. What do you think are the ways through which your higher self could take greater control? Depending on the personality of the individual, the patient also can fill up the path of yoga scale, and depending on which path satisfies him, he can be given one or the other techniques to channelize his energies towards the path with an ultimate aim of thinning out the Manomaya Kosha and its kleshas and giving an access that comes from the Anandamaya Kosha in a sustained manner without dependence on any external object. Then material can be shared for that particular path of yoga for the person to go forward.